Have you ever wondered if the power of your mind could actually control physical pain? For centuries, people have explored the fascinating link between the brain and body, but recent studies have pushed this concept even further. The idea that we can manage, or even reduce, pain using nothing more than our thoughts is both intriguing and controversial. In this video, we're diving deep into the science and psychology behind this question. Can we really control pain with our thoughts? We'll explore proven techniques, real-world case studies, and the latest data that suggest our brains might be much more powerful than we think when it comes to pain management. But is it all just placebo, or is there real science behind mind over matter? Stick around, because we're about to break down how techniques like meditation, cognitive behavioral therapy, and visualization can alter how we experience pain. We'll also reveal how top athletes, chronic pain patients, and even everyday people have used these methods to change their perception of pain. Now, let's get into the science of pain and how the brain processes it. The science behind pain perception. To understand how we might control pain with our thoughts, it's important to first know how pain is processed in the body. Pain isn't just a physical sensation, it's a complex interaction between our nerves, spinal cord, and brain. When your body experiences something harmful, such as touching a hot stove, pain signals travel from the injured area, through the spinal cord, and into the brain. Here, the brain interprets the signals and decides how to respond. But here's where it gets interesting. Pain is not just about the injury. The brain plays a massive role in deciding how much pain you feel. Think about it, two people can experience the same injury, but their pain levels can differ dramatically. This is because pain perception is influenced by emotions, thoughts, and even past experiences. Research has shown that the brain has a remarkable ability to modify pain signals. This process is known as neuroplasticity, which means that the brain can adapt and reorganize itself. Studies indicate that people with chronic pain often have brains that are wired to amplify pain, while others may have the opposite effect, learning to reduce pain signals. For instance, a 2016 study found that patients with chronic lower back pain had structural changes in their brains that made them more sensitive to pain. Yet, when these patients practiced mental exercises like mindfulness, they saw significant reductions in pain intensity. Demonstrates that the brain is not a passive recipient of pain, it actively shapes the experience. Now that we know the brain has such a powerful role in pain perception, let's explore how thoughts and emotions can either amplify or reduce that pain. How thoughts affect pain. The mind-body connection is key to understanding how thoughts can impact pain. Scientists have long observed that people's mental states can either increase or decrease their sensitivity to pain. Anxiety, stress, and fear tend to make pain worse, while calmness and positive thinking can reduce pain levels. One fascinating phenomenon that highlights the mind's power over pain is the placebo effect. In placebo studies, people are given fake treatments, such as sugar pills, but often report feeling better, even if no actual medicine was involved. How? Because their brain believed they were getting relief, it altered their perception of pain. Studies have shown that up to 40% of patients experience reduced pain with placebos. Converse the nocebo effect, where negative thoughts or fears about pain can actually make it worse. If someone expects something to hurt, their brain primes them to feel more pain, even if the physical injury isn't severe. This proves that the mind's expectations play a significant role in pain perception. Let's take the example of soldiers in combat. In World War II, a doctor named Henry Beecher observed that soldiers wounded on the battlefield often reported little or no pain, even though their injuries were severe. This is because their minds were focused on survival and relief from escaping the battlefield. Essentially, the brain dialed down the pain to prioritize more important tasks. Through this connection, we can see how altering thought patterns can help manage or even control pain. But what specific techniques can you use to harness this power? Let's dive into some proven methods next. Proven techniques for controlling pain with your mind. Now that we understand how the brain shapes our perception of pain, let's dive into some proven techniques that can help you control pain with your thoughts. These methods have been studied extensively and have shown real, measurable results for many people dealing with both acute and chronic pain. Mindfulness and meditation. One of the most effective techniques for controlling pain is mindfulness meditation. This practice involves focusing on the present moment and accepting it without judgment. When it comes to pain, mindfulness teaches you to observe the sensation without immediately reacting to it with fear or tension, which often intensifies the pain. A groundbreaking study conducted by Wake Forest University found that mindfulness meditation can reduce pain intensity by 27% and pain unpleasantness by 44%. This is because meditation helps to deactivate areas of the brain responsible for processing pain, particularly the primary somatosensory cortex, which is where physical sensations like pain are processed. One real-world case study involved chronic pain patients who practiced mindfulness-based stress reduction (MBSR) techniques for 8 weeks. At the end of the study, many participants reported significant reductions in pain intensity and an improved ability to cope with discomfort. Cognitive behavioral therapy (CBT), cognitive behavioral therapy (CBT), is another powerful method for controlling pain. CBT teaches people to recognize and change negative thought patterns that contribute to their pain experience. For example, if a person catastrophizes pain, thinking that it's unbearable or never-ending, they will likely experience more intense discomfort. CBT helps to break this cycle by reframing these thoughts. Studies have shown that CBT can lead to a 30–60% reduction in pain for patients with conditions like fibromyalgia, arthritis, and chronic headaches. The beauty of CBT is that it focuses on mental resilience, showing people that they have the power to change their internal dialogue, which in turn influences how their brain processes pain. One case study highlighted a patient with chronic migraine headaches who, after undergoing CBT for 6 months, reported a significant drop in the frequency and intensity of headaches. The patient credited this to learning how to change their response to stress and fear related to the onset of pain. 3. Visualization techniques. Visualization is a technique where you use your imagination to picture yourself in a peaceful or healing scenario. This method helps shift focus away from pain and reduces stress, which is often a pain trigger. In one study conducted at the Cleveland Clinic, patients who practiced visualization techniques reported a 25% reduction in their pain levels. They were asked to visualize their pain as a physical object that could be manipulated. Some imagined shrinking it down, while others visualized it being flushed out of their bodies. Athletes have also used this method. Olympic-level competitors often use visualization to mentally prepare for injury recovery, imagining their muscles healing faster. This mental training can actually have physiological effects, helping them heal more efficiently. 4. Breathing techniques. Controlled breathing can also play a significant role in pain management. Slow, deep breathing helps activate the parasympathetic nervous system, which induces a state of relaxation, counteracting the body's stress response to pain. A study published in the journal Pain Medicine found that deep breathing exercises can reduce chronic pain by up to 20% when practiced regularly. By focusing on your breath, you distract your brain from the pain, while also reducing tension in the muscles that often accompanies pain. 5. Biofeedback. Biofeedback is a technique that involves using electronic monitoring to train individuals to gain control over certain physiological functions, such as heart rate, muscle tension, and skin temperature. These factors can all influence how pain is experienced in the body. Research from the Mayo Clinic has shown that biofeedback can lead to a 30–40% reduction in pain for individuals suffering from chronic conditions like migraines or back pain. By learning to control these autonomic functions, patients can reduce their body's stress response, ultimately lowering pain levels. Each of these techniques offers a different way to harness the mind's power over pain. Whether through mindfulness, cognitive reframing, or breathing exercises, the science is clear: the brain can alter how we experience physical sensations. But how do these techniques work in real life? Let's explore some real-world case studies next. Now, let's dive into some fascinating real-world examples where people have successfully controlled or significantly reduced their pain using the power of their minds. These case studies showcase how techniques like mindfulness, cognitive reframing, and visualization have transformed the lives of those suffering from chronic or acute pain. Case Study 1. The chronic pain survivor. Take the case of John Kabat-Zinn, one of the pioneers of mindfulness-based stress reduction, MBSR. His work with chronic pain patients at the University of Massachusetts Medical Center changed the way we think about pain management. Kabat-Zinn's program involved an 8-week mindfulness meditation course, during which patients were taught how to observe their pain without becoming emotionally or mentally overwhelmed by it. In one of his most well-known studies, patients with chronic pain, who had been resistant to conventional treatments, saw a 50% reduction in pain intensity by the end of the program. Many of these individuals had been living with debilitating conditions like arthritis and fibromyalgia. By focusing on the present moment, patients learned to stop their brains from amplifying pain, leading to a much improved quality of life. Case Study 2. The athlete who pushed through pain. Another compelling example comes from the world of professional sports. Kelly Slater, a legendary surfer, has spoken openly about using visualization techniques to manage pain from his injuries. In his career, Slater has dealt with a wide array of physical injuries, but his mental toughness is what sets him apart. By visualizing his body healing and focusing on the feeling of success post-injury, Slater claims to have recovered faster than expected from painful injuries, allowing him to maintain his competitive edge well into his 40s. Visualization not only helped Slater recover but also improved his focus during competitions, allowing him to push through pain barriers and remain calm under immense pressure. Case Study 3. The cancer patient. A particularly powerful example of mind over pain involves a cancer patient who, after undergoing chemotherapy, dealt with intense physical pain and nausea. She was introduced to cognitive behavioral therapy, CBT, as a way to manage her symptoms. Through CBT, she was able to reframe her thoughts around the pain, focusing less on the sensations and more on positive imagery of recovery. Over time, the patient reported that her pain levels decreased by 40%, and she was able to manage the side effects of treatment with far less medication. This case study highlights how, even in the face of extreme medical conditions, the mind's ability to alter pain perception can provide significant relief. Case Study 4. The placebo effect in action. One of the most well-documented examples of mind over pain is the placebo effect. In a groundbreaking study, patients undergoing knee surgery were divided into two groups. One group received real knee surgery, while the other group had a fake surgery where doctors only made incisions without performing any real intervention. Remarkably, both groups reported similar levels of pain relief post-surgery. This study, published in the New England Journal of Medicine, underscores the power of the mind in healing and pain perception. The brain, believing the surgery was real, altered the patient's pain experience despite no actual medical intervention. This case is a powerful reminder of how mental expectation can have a profound effect on physical pain. These real-world examples demonstrate that mind over pain techniques are not just theoretical, they have been applied in practical, life-altering ways. Whether it's a professional athlete, a cancer survivor, or someone dealing with chronic pain, the brain's ability to influence pain perception is evident. However, not everyone in the medical community agrees with these techniques. Let's explore the controversy surrounding this approach next. What about skepticism and limitations? While the idea of controlling pain with your mind is fascinating and supported by numerous case studies, it's not without its critics. Many in the medical community remain skeptical about the extent to which thoughts can influence pain, especially when it comes to severe or acute injuries. Let's explore some of the controversies and limitations surrounding these techniques. The skepticism in the medical community. Some doctors argue that while mental techniques like mindfulness, CBT, and visualization can be helpful for managing chronic pain, they may not be sufficient for more severe, acute pain. For example, no amount of mental reframing can prevent someone from feeling the immediate pain of a broken bone or a severe burn. In these cases, traditional medical interventions, such as pain medications and surgeries, are crucial. Critics also point to the fact that not everyone responds equally to mind over pain techniques. Some people may experience dramatic improvements, while others see little to no effect. For instance, a 2019 review published in the Journal of Pain found that although CBT and mindfulness techniques were helpful for some chronic pain patients, around 30% of participants in studies did not report significant improvements in their pain levels. This has led some experts to caution against seeing these methods as a one-size-fits-all solution. Placebo versus real impact. Another point of contention is the reliance on the placebo effect in some studies. While the placebo effect clearly demonstrates the power of the mind in altering pain perception, some critics argue that it's not a reliable long-term strategy. If a person's belief in a treatment can fade over time, the pain relief may also diminish, which raises questions about the sustainability of these techniques. Limitations of mental techniques. There are also limitations to how far mental techniques can go in controlling pain. While they may work well for chronic pain conditions or psychosomatic pain, pain that has a psychological origin, they may be less effective for pain caused by severe physical trauma. For instance, mental techniques might help someone cope with the aftermath of surgery, but they cannot replace anesthesia or pain management drugs for the surgery itself. In conclusion, while mind over pain techniques have shown great promise, they are not without their limitations. It's important to understand that these methods work best as part of a holistic pain management approach, often in conjunction with medical treatments. So, while the mind can be a powerful tool in controlling pain, it's not a replacement for traditional medical care when needed. Let's wrap up with the key takeaways from our exploration of the mind's power over pain. Controlling pain with your thoughts may sound like a futuristic concept, but as we've explored, the science behind it is solid. The brain plays a crucial role in how we perceive pain, and by using techniques like mindfulness, cognitive behavioral therapy, visualization, and biofeedback, we can actually alter that perception. These methods have been proven in clinical studies and supported by real-world case studies, from chronic pain sufferers to athletes pushing through their limits. However, it's essential to remember that while these techniques can be incredibly effective for some, they are not a cure-all. The mind's power over pain has its limits, and for severe injuries or acute conditions, medical intervention remains critical. As more research emerges, the mind-body connection continues to provide exciting possibilities for pain management. Whether you're dealing with chronic pain or looking for ways to push past discomfort, these proven techniques offer an alternative way to engage with pain that goes beyond traditional medicine. So, why not give it a try? You may find that the key to managing your pain lies within your own mind. Thank you for watching, and if you found this video helpful, make sure to like, subscribe, and share it with anyone who might benefit from learning about the power of the mind in controlling pain.